Welcome to the Weird Works podcast. I'm Dr. Christy, your host. Join us for conversations about alternative and sometimes controversial healthcare topics. This podcast will provide the evidence that you need in order to make informed decisions about your health, to empower you with the facts that you need to advocate for your health, and to encourage you that there is hope your body heals. Join us from experts from all things weird, as well as the testimonies of people with stories of radical healing who were once told that perhaps their condition was a death sentence, that they would just need to live with it, or that drugs and invasive surgery were the only answer. Let's get into agreement that if there is something natural and non-invasive that could be helpful, that it could be your first option rather than your last resort. Hi, everybody. We have another wonderful episode of the Weird Works podcast. This is an episode that I wanted to do for a while on biological dentistry. And today I have Dr. Rachaele Carver with me. She's another awesome doctor that I met through Cellcore, one of our favorite supplement companies. They just do awesome continuing education and get all these amazing minds together at least a couple times a year. So I'll let you know a little bit about Dr. Carver, and then we're going to talk about how dentistry is not just about your teeth. So Dr. Carver attended UConn, University of Connecticut School of Dental Medicine, and she received her doctorate in '03. And she just continues to expand her practice using the highest quality services. She consistently, like at ECO, attends continuing education classes to learn about the latest improvements in dentistry. And she's a Dawson Academy scholar. So it means she did 2 years of additional training to become more proficient in TMJ diagnosis, complex aesthetic and functional cases. And then in 2016, she earned her nutrition certificate from Institute of Integrative Nutrition, which we're very familiar with. And she uses that education to treat the patient's whole body. And she is also certified in ozone therapy. We'll talk a little bit more about what that is and what it's useful for. And then in 2020, she received her board certification in naturopathic and biological dentistry. And so, our audience, the reason why I brought Dr. Carver on the show is because naturally, as we're working on people's health and nutrition and detoxing their body, they would love to know about dentists who are knowledgeable about radiation and X-ray, fluoride, mercury, controversial topics like root canals, etc. And we're going to dive into all of that. And so thank you for joining us. Welcome to the show.
Well, thank you for having me. It's a pleasure to be here.
Awesome. So I always like to kind of start out, what was your journey? How did you get into this world? When you went into dentistry, did you know about this functional holistic practice, or how did it start?
Absolutely not. And I think most of us who get into this field, we all have a story, right? Whether it's a personal story or somebody, close to us. So I was conventionally trained, I think the only thing about me was that I've always been open-minded. I've never been one to just follow a given path, and I love to learn. So my journey started after my second daughter was born, and I developed eczema all over my hands. So as a dentist, it was very uncomfortable, couldn't understand. So of course I went to the dermatologist, and they just wanted me to be on steroids, one steroid after another, until they gave me one that was a very strong immune system altering drug. And I said, wait a minute here. It was just my aha moment when I said, you know what, my body is trying to tell me something. I just have to figure out what it is. And so I fired all my conventional doctors and I just started reading. I mean, the thing that we don't realize is there's so much of this information out there, but so many of us are just not aware of it. And even, most conventionally trained doctors and dentists have no idea that all of this science and information exists. And so, it really was a 10-year journey. And until I found Cellcore, my eczema would get better, but then it would get worse. It would get better, it would go away, but it would always come back until I found the Cellcore products, took some their parasite products, got rid of my eczema once and for all. So that was my problem. My parasites were blocking my liver bile ducts, which was leading to all sorts of problems, right? And as I was going through this journey, it just made me think about dentistry different, wow, if medicine, maybe dentistry can be done differently and better also. I just, when I started reading about all these toxicities and things, I thought, wow, we use a lot of heavy metals. We use a lot of toxic chemicals in dentistry. Maybe there's a better way. And so one of the first things I learned about through the Dawson Academy is about the bite, what's happening. We don't learn really anything about the functional aspect. A lot of it, dentistry is all about the bacterial, the cavities, the gum disease. That's pretty much what you're learning, right? And we learn, how do you kill the bad? Which those of us in the holistic world know that's not really the right approach to take if you want to regain total health, right? If you want to symptomatically treat things, fine, but that's not how you get at the root of true health, and how do you get the body back to the way it should work. And so then in 2016, I really was interested in nutrition because, as you know, so many of the pioneers in health were dentists, in nutrition, right?
I have a couple awesome names on here that we're going to talk about.
Right. We'll talk about that in a minute, but, and it makes sense, right? I mean, the mouth, right? That's the beginning of the gut. This is our territory. So, we really want to understand how more diet and nutrition could affect this, not just trying to use fluoride or, scrape the teeth or drill them out. And then I got into ozone. I was actually going to a colon hydrotherapist who was using ozone. I'd never heard of it before. I was researching, went onto the website, and they had ozone for dentistry. So I took a couple of courses, and that has just completely transformed my practice in so many ways. And then through that same provider who taught me ozone, I did the 2-year course to get my naturopathic. So again, it was just more information, learning about the root canals, the fluoride, the mercury, and I belong to a couple of the biologic associations now. And I've gotten more certification through both of those organizations to really understand, and then to be able to bring it back to my patients. And so now, my patients, they're getting the whole body care. If they want to, really make a big difference, then we know we kind of need to start at the mouth.
Yeah, I love it. Well, and like you had said at Cellcore, 80% of chronic diseases actually can stem from the mouth, right?
Mm-hmm. Yeah,
people don't think about that.
They don't. And because, learning more about Cellcore and just in more of my education, I've really come to believe that all disease is toxins, and infections, right? And the toxins from the infection, right? So you could just say it's all these toxins, toxicants, whatever you want to call it. And I don't care what you name it, you want to label it this, label it that, but if you really bring it down to the root, there is some kind of toxicity that's causing a deficiency, right, in the body. It's causing inflammation. So if we can figure that out, find that toxin, remove it, the body knows how to heal itself. We are designed to be a healing organism. The problem is we live in such a toxic world, and we have very poor diagnostics, and healthcare has just become very systematic. Here's your symptom, here's your drug, right? And that's not wellness. That is disease management, which you, myself, those of us who are in this world, we don't believe in that. We believe in wellness, that we're supposed to be well, right? And so the thing about the mouth is there are so many infections, so much bacteria, well, there's an entire microbiome just in the mouth. And a lot of the dental procedures that we do create these toxins, but people don't think about it because most of the time they don't feel bad, right? And so that's another reason why in a biologic dentist, you're going to have a different kind, like a 3D x-ray, that's going to be able to see these infections that a conventional x-ray isn't going to be able to see. So things like root canals, having different kind of metals in your mouth, a lot of the products we use, even the tooth colored bonded fillings, that's just the plastic. So is that better? Maybe a little, but, that's why I get really into how do we prevent this? How can we reverse these kind of things so that we don't have to put these chemical in people's mouth? But there's a lot of stuff going on in the sinus. Again, I can't tell you how many people I take the 3D x-ray and we see sinus full of fluid or weird little polyps. They feel nothing. So they have no idea. They could have some kind of fungal infection, bacterial infection, parasites up there, right? But would have no idea unless they went to a biologic dentist, that sinus infection may be causing inflammation somewhere else, right? I mean, the whole tooth meridian chart is fascinating to know that every single tooth is its own organ. I think that's an important thing for people to realize. We kind of think of teeth as just this mechanical thing that we use to chew food, but every tooth has a nerve supply, a blood supply, lymph supply. So anybody who's had a toothache, that there is a nerve in that tooth, right?
You feel it.
So, just like, the heart or the kidney or the liver, this is a living, breathing thing that we have to take care of because it is connected via all those different things to the rest of our body.
Yeah, it's funny because our thermography tech is here right now doing thermography today. We have a mobile service that comes in about once a month, and that's actually a big way that we refer people to our dentists is they find all sorts of, like abscesses and things in the sinus that people weren't even aware of.
Right.
So, do you guys have thermography on
We
site or do you
don't.
use it?
I love it though. I think it's
Okay.
really, really beneficial. Again, and some things you might not see on even the 3D X-ray, but thermography is a wonderful way to catch something kind of early. When you see that heat, there's something, there's some kind of inflammation. So it helps you to investigate things. I'm a big fan of the breast thermography because traditional mammography, you really have to have something big there to really see it. So I think it's huge. All these, there's so many great diagnostic, and there's less, no radiation, right? That you get in those
Absolutely.
conventional kind of ways. So I think, and I've looked over the years to purchase one. I've just never bit the bullet and got it, but I think it's very valuable.
Yeah, that was actually one of my questions. I know, do you want to talk about, you brought up so many good things. I'm like, okay, we gotta go back.
Yes.
So the thermography, the tooth meridian chart, which I'm actually going to put a link. Do you have a link on your website?
I'm not sure. My website is not the greatest. It's still
okay.
It's in progress.
It's
but
just
it's
cool
very
because I know
easy.
there's
Google
interactive charts where you can click on the tooth and see the meridian. And so do you want to talk about the link with breast cancer and certain tooth meridians?
Absolutely.
Since we're on that topic.
So if any of you are familiar with Chinese medicine, we talk about there are 13 main meridians that kind of connect the top of our head to our toes. And these are just pathways that again connect different parts of our body. So every tooth is on a specific meridian. Some teeth are on the same meridian, right and left side. So breast is something I see a lot of in my, I've learned a lot about it, but I have seen it a lot in my own practice where an upper first molar, so we call that tooth number 3 or tooth number 14, that is on the breast, stomach meridian, and spleen. So spleen in Chinese medicine has a lot to do with our digestion. And so if you have a root canal in an upper first molar, or maybe you don't even have maybe you had a large filling and it's abscessed, but you don't know because some people, a tooth will abscess and you don't have any pain at all. Sometimes you do have pain sometimes. And then sometimes a tooth will abscess. It's really painful for about a week. And then once the tooth completely dies, there's no more feeling anymore, right? Because the nerve is dead. However, anything dead in the body is going to harbor bacteria, viruses, parasite, you name it. So it might be sitting in there and you feel nothing, but there's infection going on. So basically there's a physician, Dr. Jerry Tennant out of Texas, and he talks about every root canal or every dead tooth kind of works, a tooth in general is like a circuit breaker. So if you have a root canal or an abscess tooth, if that tooth is dead, imagine that circuit breaker is off. So what that means is not saying that a diseased tooth or root canal tooth is causing breast cancer. What it's saying is that there's less energy along that pathway to be able to fight any other problems that our immune system might encounter. And the way I describe this to patients is, imagine if your immune system army has 100 soldiers. If 60 of those soldiers are up there trying to deal with that chronic infection or inflammation from the dead tooth, that means you only have 40 left to deal with any other problem along that entire pathway. Right. And so that's really a problem. There's less energy because we make cancer cells every single day in our body, right? Our immune system is constantly surveilling and looking for things. And in a healthy system, a healthy body that has plenty of energy, we are able to deal with that. But if you're only functioning at 40%, some of those cancer cells may go missed, or there's not enough energy to get rid of them. So that's what we talk about when we're talking a lot about these issues in dentistry. There are some direct correlations with oral bacteria causing heart attacks because they've found a lot of oral bacteria in those clots in heart attack victims. So you can say that's definitely a cause and effect. And that's one that it's pretty well established and accepted, right?
Yeah, people kind of know, right? If they have
know that
prolapse, they have to take antibiotics before they get, but you guys probably use ozone instead of antibiotics.
Exactly. Yeah, I don't love antibiotics because, some of you may know, maybe your patients who are very savvy know that too many antibiotics, they kill the gut flora. And we're learning more and more and more how gut bacteria in general are absolutely vital to our wellness. It's just, we develop bad first because of the toxins. We create deficiencies, and that makes the so-called bad bugs proliferate, because those more pathogenic bugs, they can survive in a more acidic environment. They can survive in a nutrient poor environment, and that's why they take over. So by just trying to kill, a gum disease, right? Just trying to kill it with antibiotics or these harsh antiseptic mouth rinses, or, all these toothpaste that have fluoride. Yes, it does kill that bacteria, but that's not the cause of the problem, right? There's some kind of toxicity that led to the deficiency that caused those bacteria to overgrow. So if we just kill the bacteria, but we don't create that healthy environment, we're never going to get well. So then you're in that cycle as, oh, I've got periodontal gum disease, so I go to the dentist every 3 months. Wouldn't it be great if we fixed the whole terrain in the mouth, and then you wouldn't have to, go every 3 months because you have fixed the problem. You've actually gotten at the cause of the problem. So that's what a biologic dentist really does. And as you had written, it's important to know that biologic dentistry is not a specialty. There is no school that you go to learn biologic. There are some programs like the one that I did to become board certified, but there are plenty of people who are biologic dentists who haven't done that program. So it's more of a philosophy, is that we're thinking about root cause, right? What is the cause of these dental issues, and how can we go about restoring the proper environment in the mouth in order to have health? So, when you're looking at different biologic dentists, and maybe we'll talk about that a little bit later, but there's ways to, to kind of investigate and ask the questions that you want.
Yeah, how to vet your dentist.
Yes.
That was one of I had an aha moment listening to you, and you just said it a little earlier, but I wanted to highlight it, that the mouth is the beginning of your gut. And so when you had said that, I think you were talking, there was a whole, series about above the collar when we were at ECO, and you were talking about how all that drains down in the gut, the stomach, the intestines become a collection for all the stuff. You want to talk a little bit more in depth about that?
Sure. So we swallow about 2 liters of saliva a day, right? So imagine if you have that poor environment, and something as simple as doing a pH paper test, you can buy that on Amazon, right? And you can check your pH. And ideally, we want to be in about 6.5 to 7.5 pH in good range. When you're in the 5 range and your mouth is more acidic, then we know there's something going on. And it's the chicken and the egg thing, right? Is it the oral bacteria that you're swallowing that's bad, that's causing the gut problems, or vice versa? And I don't know if there's a definitive answer. It's all connected, right? So a lot of times we see if the mouth is acidic, then there could be low stomach acid. So why are you having gum recession, right? Why do you have periodontal disease? Is it just bacteria, or is it the problem with not having enough stomach acid, right? When we don't have enough stomach acid, then we don't absorb our vitamins and minerals, right? You need vitamin and minerals for your teeth. You don't make enough bile, which is also stimulates your digestive enzymes, so everything is just so intimately connected and causes a lot of problems. But most dentists say, oh, you're just brushing too hard. Not necessarily, right? You may, and when we are acidic, so if you consistently, first thing when you wake up before you have any food, are consistently acidic on that pH paper, then that means that it could mean a lot of things, but you're not getting enough minerals, right? And when we don't get enough minerals in our food, which can be really challenging these days because our diet and our food supply is so deficient in minerals specifically, we don't get those minerals, and that's what balances our pH. So if we're not absorbing those minerals because we don't have stomach acid, because maybe we're too stressed or we have some other toxicity, and we're not producing that stomach acid, then where are those minerals going to come from, right? The blood has to maintain a very tight control of that pH. So if you're not getting minerals from your diet, then you've got to get them from somewhere. And the highest concentration of minerals is in our teeth and our bones. So think about that for what is gum disease? Basically, in my opinion, it's an autoimmune condition, right? So there's toxicity, and we get an increase in those bad bugs that then cause, they release their own toxins that lead to the destruction of the bone in the mouth. So we need to have enough minerals, and otherwise, that we're losing them at the cost of our teeth and our bones,
Yeah.
and that is, we need those minerals to balance that pH. So it's really, really important, one, that we're getting that good diet. And that's why I think supplementation is important. I love Cellcore CT minerals. It's just really profound. And because it's also made from nature, it's not a synthetic supplement. So yeah, really important. Again, just really looking at, well, what's causing these issues, right?
Right.
So thinking beyond normal conventional medicine and dentistry.
Yeah, I love it. Well, and so we talked about like going down, and then what about coming back up, right? So I know in traditional, dentistry, they say like if you have bad breath, it's periodontal disease or bacteria in the mouth, but it actually could be putrefaction of like, or rancid fats and, undigested proteins, correct?
Absolutely. And it makes me think of one patient I had specifically, and he kept coming back because his breath, I said, this is your gut. Like, let's get you on some probiotics. Let's, get some liver detox going. Let's get you on some binders. And that was that, but he didn't believe me because I was a dentist, but he went to the GI doctor who gave him all that stuff, and it worked. I was like, it's not, it's not coming from the mouth per se.
I know, it's crazy. Like even patients are trained to think in pieces and parts. Like, we've always said like the more narrow the specialty in medicine, kind of the least likely to see the whole picture. Everybody's like, this is my area of the body, and they don't see the relationship to all the other areas, which we know that's just not how, we're not a watch. You can't take apart the gears in the hands and the face and,
right.
and like function anymore. It doesn't work that way. But even patients are trained to think like that. Like, I'm a chiropractor and a nutritionist, and sometimes they don't think to tell me the whole story or about their stress levels or their home life, because they're like, oh, you can't help me with that. And like, they're going to tell you their gut issues, because they're like, oh, I'm just here for you to take care of my teeth. So like, it's sad that even the patients, you have to change their philosophy about who to talk to.
Are you tired of going from diet to diet to come up short and feel worse than you did when you started? Or are you just lost with all the mixed messaging out there today and not sure what's best for you and your lifestyle? Maybe you were told that you had to live with your symptoms and accept feeling less than your typical vibrant self. Well, I'm here to tell you the truth. As a practicing doctor of chiropractic, kinesiology, and clinical nutrition, I see people all the time that are just like you, frustrated and starting to lose hope. But I do want you to know that you do not have to give up on the you that you know you could be. There is a way to truly achieve optimal health and also to live your life. I want to share with you how, by doing some small, doable adjustments and taking on a new approach to enjoyable and non-restrictive eating, we can help you start feeling better and begin to see changes in your waistline and start releasing weight in as little as 14 days.
Yeah.
Yeah. So, and when one of my first questions, my patients was like, how are you pooping? They'd look at me like, what?
Yeah.
And say, well, we can't get the toxins out of your body if you're constipated. It's a big problem. And, that brings up the conversation, because that's a very, very common problem. And you're just never going to get well if you can't get the waste out. Right. And so, that's a big conversation I have in the dental office almost every day.
I know. You talk about poop. I'm just so glad you brought it up before I did, because everybody laughs at me. Like even my friends, like every text message somehow comes back around to poop. And they're like, that's really all you talk about. And I'm like, I guess it is, now that you point it out. I'm like, but it's not just me, it's my colleagues too.
That's right. That's right.
So while we're on this nutrition topic or conversation, so I think our audience, most people would recognize the names Weston A. Price and Dr. Rachaele Lee. And if you haven't, they were some of the foundational people that did work in nutrition, but they both were dentists. And so a lot of the foundational work on what we know as nutrition, right, today was done by these docs who they went around and studied indigenous people, and they studied the health of their teeth, their jaw, like literally the bone, the dentition, what it looked like, the structure. And there's some amazing before and after photos of like indigenous people. And then after the commercialized westernized diet started coming to place, like the structure of our face and bones like literally change, and you can see it. Like you don't have to be a doctor to see the disruption. So I was just curious for you, Dr. Carver, like did your
standard traditional dentistry talk about it? I didn't think so. Here in school,
No.
they didn't say anything about these awesome people,
No,
right?
I mean, dentists get nothing, but even physicians barely get any nutrition training, so, and that's at the, cornerstone of health. It really is. What we put in our body is what's going to help make it work, right? So it was really fascinating. And Weston back in the 30s, discovered all this stuff. And what was fascinating is that, he discovered a common theme because he did, the Aborigines, and he was in Africa, and he was in Papua New Guinea, all these they had very different diets, but the common theme was 10 times the amount of minerals and 4 times the amount of fat soluble vitamins in their diets. And that is, we were just kind of talking about minerals, right? It's so cool. And then the fat soluble vitamins are vitamin D, A, E, and K. And, that I talk to my patients a lot about those. It's so crucial to create healthy teeth. And nothing where, so many women are like, yes, I'm on vitamin D and calcium, which is kind of depressing that still, 30 years after that major study came out saying that led to heart attacks in women, that doctors are still prescribing calcium and vitamin D. If you do not balance that calcium and vitamin D with vitamin A, with magnesium, with vitamin K, then you don't put the calcium where it needs to go. And it ends up precipitating out in your mouth like tartar, or in your arteries like plaques. So some people say, yeah, I build tartar, it runs in my family. No, there's other things maybe that run in your family, like the inability to detox properly or something like that. But when we see calcium, to me, I'm like, you're not having enough vitamin K and vitamin A. And often now you'll see vitamin D supplements combine D3, K2, which is great. Finally we're catching on a little bit, but you need that interaction of all those vitamins and minerals together in order to make things work. So when we just take one supplement here and one supplement there, that's not how the body works. And that's why food is so crucial, because when you eat whole, natural foods, those vitamins are all together. Like, for example, if you were to eat an apple versus apple juice, right? Most people would know that the apple is healthier, right? Because the juice is all sugar, because in the juice, we've processed it. We've taken out the fiber. We've taken out some of those nutrients that make the whole apple more nutritious. And so that's what happens when we're eating. And I get it, we live a crazy life, and modern life is not really convenient for good eating. Right. But anything processed, we're stripping those nutrients, and that's why it becomes more harmful. This is why pharmaceuticals have so many side effects, because they're taking most of the time of pharmaceuticals coming from nature. Right. But they're stripping all of those, like the fiber in the apple, they're stripping that out, just looking for what they think is the active ingredient. But it may be an active ingredient, but it's all the other inactive stuff. That's what helps our body be able to, absorb and metabolize those things. Right. So you can't strip that out and expect not to have a side effect.
Yeah, nature always knows best. Like, you just can't trump nature or God, right. You can't trump it. You can't reproduce it or do it better. Well, that was what Dr. Rachaele, one of the dentists that we were just talking about, he created standard process. So if you guys don't know, most of our patients are on some kind of standard process, and that's because it's whole food. And he just had that infinite wisdom that, like, the food on the planet already has exactly what Dr. Carver is saying, all the cofactors, and it exists that way, the way the body can recognize it as food, and the best way that it can digest and absorb it without all these isolates and synthetics. And so, you still need to eat your food and pick good quality choices the best you can for what's available. And when you can't, the next best thing is whole food supplementation, but much different than even like, just were quoting that, study about calcium and vitamin D. It's also like synthetic stuff that's over the counter. And I just have to say this for a second. I feel like at least once a month, there's some news channel that comes out with like, studies, supplements are bad for you, linked to heart disease and cancer and all this stuff. And we're like, well, no kidding. That's the synthetic stuff that's over the counter. Like, we never told you once to go get that stuff, or that was a healthy, replacement. But it's just the knowledge. That's why we're here. Yeah.
I have that conversation all the time with my patients, that there is this controversy, and rightly so. There's a lot of junk out there, and they'll watch, I have family members, who they'll see something on Dr. Oz and they run out and buy it, and I'm like, well, but what is it made of, where is it coming from, and do you really need that? So it's interesting. And that's why the other thing about biologic dentistry and, what you do is it's personalized, it's individualized, because you have high blood pressure doesn't mean, and we're going to just throw everybody on this drug, and I wonder why there are so many blood pressure medications, right? Because we're all different people and we all may have high blood pressure for different reasons.
Right.
And again, all back to that toxicity, and even as a dentist, the one thing that's been really important to me is that emotional component. And that is another thing that often gets overlooked, but I see it in my practice. When you have a tooth out, if you look on some of those meridian charts, you'll see emotion also connect, because some of your patients, they may be familiar with how emotions sit in our organs, right? I always think about the liver, right? Resentment, anger, bitter.
Yeah.
You have that person who's always angry, their liver is probably inflamed, right? And then the liver is related to the canine teeth, the pointy teeth in the mouth. So again, teeth can have these emotions too. I took out a tooth on a woman yesterday and she was like sobbing the whole time and she was perfectly numb, but so I started to do some kind of energy work on her and, because I was like, oh, wow, there's something big here. It's not just, yes, it's traumatic having something taken out, but there's emotion stuck in the teeth too. So, sometimes people come in and they have a toothache, but the dentist can't find any reason. I don't know why it's, hurting. What's going on emotionally, right? Is that problem you're having in the tooth manifesting in the tooth, but it's really coming from somewhere else. And that's why being holistic and understanding the body works as a whole is so vital, because I can't tell you how many patients I've heard stories, they have like 6 root canals in a row because the dentist was like, oh, it's this tooth, I'm just going to take the nerve out. No, still have the pain. Oh, I'm going to take this tooth, and never find the actual reason. This is an interesting thing that some patients may have a lot of. Sometimes we get referred pain to our upper teeth. And many times it can be coming from an old extraction site. So lower wisdom teeth are the most common to have dry socket, right? Which basically means, when you have a tooth out, the blood clot comes out, doesn't heal. And so you end up getting kind of a bone cavity. And this, just like kind of a root canal, an open space, and even though the tissue will heal over and you feel nothing. So again, another reason why a lot of disease can come from the mouth. Extractions, these cavitations are huge. And so this open hole, there's no blood supply. So it's a great place for parasites, for Lyme, for, bacteria, you name it. Any microbe loves to sit in there because the immune system can't see it, but they're still spilling their toxins out into the lymph tissue, right? And again, think about the head, the lymph is draining all down your neck, right into the breast tissue. So that's why really important. Dental infections are really important for women because it just drains directly into the chest.
Right.
So that's why thermography is really beneficial, because you can see if there's a hot spot. Sometimes you'll see a red line going right to the breast, right where it's draining. And then a lot of us have, with modern living, we have lymph congestion. So if we're kind of congested in our abdominal area, then it sits in the breast. It can't drain down to, the bowels to be removed. So lymph, that's a whole other, big story, obviously, to get into.
That's a great analogy, though. I think everybody's going to be able to understand that picture that you just painted. Yeah.
And so just to finish the thought here, so if you have a cavitation in a wisdom tooth here, in which you can only really see on a 3D x-ray, you have a nerve that has like 5 arms, right? So if this arm is affected by the cavitation, you can feel, because they come back to a common spot, you'll feel pain in the upper. And I've seen a couple patients, I just had a follow-up the other day. I said, yep, it's cavitations causing this pain.
Yeah. And
she did not want to have surgery. So we used ozone, just straight ozone. And a year later, I kept looking at the x-ray and I'm like, wait a minute, it's gone. The cavitation is gone and her pain is gone, just using ozone directly into that area and healing. Killing, because ozone is really good at killing virus, bacteria, parasites, fungus on contact. It stimulates blood flow. It's all natural. There's no side effects, no contraindications. And we could be totally non-invasive. I did not have to cut into her jaw to clean this out, just using the ozone. So that was super exciting to see.
That's great. How is the ozone? Is it injected and a cannula? I've heard there's a bunch of different ways.
There are a lot of ways. So we will use ozonated water. So we switch, when we're doing our cleanings, when we're doing a filling, we're not using the water out of the tap. We're rinsing everything with ozonated water. So that's one easy way to get it. If we have, let's say, a deep cavity and worried about it being close to the nerve, I will use the gas, and I just squirt the gas right onto the area of the tooth.
Okay.
We will also inject it. So if somebody has tooth pain, we will inject the gas right into the, as just like you were getting an anesthetic needle. We inject the ozone there. People who have cold sores, it's amazing. You can get rid of that cold sore forever. It's really, really amazing. Just when you start to feel the tingle, you give that injection of the ozone, boom, gone. And in my experience, they do not come back.
That's amazing.
Pretty exciting for people who deal with that all the time. It's very exciting.
Yeah.
I use a lot of ozone too with neural therapy.
Okay.
So, I don't do a lot of splints anymore. Using procaine, which is a mild anesthetic, and ozone, we call this therapy prolozone therapy. I also mix in a couple of homeopathics, which are getting harder and harder to find, unfortunately. One is a lymph draining and a couple of anti-inflammatories. I've had 100% success getting rid of pain in the joint. Not only does it get at the root problem and drain away the inflammation, ozone can actually regrow cartilage, and you're getting actual repair of the ligaments and the tissue up there, which is incredible.
Awesome.
Like no steroid can't do that. Botox doesn't do that. Those things are just stopping inflammation, stopping pain. Procaine and ozone actually fix and cure the problem. It's really, really profound. And that whole idea of neural therapy. The other thing that's exciting about it is it's stimulating your autonomic nervous system, right? And we do not spend enough time in our parasympathetic nervous system anymore.
Amen.
Right? And so when you stimulate that, you're stimulating the parasympathetic nervous system to get into that rest, repair, digest type of the healing state, right? So many of us are just stressed out even if we don't necessarily feel stress, just the environment itself is stressful to our cells. And so the more time we can get in that, the better. And so that's a really profound treatment.
Yeah. Well, now that we've kind of been going through some of the therapies, I have some more. So I know we'll kind of compare and contrast controversial practices that are common in traditional dentistry, and then some of the I like to say more enlightened functional dentistry practices, because there's one on here that I didn't even know about. So we talked a little bit about x-rays. Do you want to talk about, with some patients, I know they're like, oh, I don't even want to go to a dentist because they still are requiring x-rays. And I'm like, I know, but if they're the 3D and digital, they're less radiation. So do you want to maybe kind of calm patients' concerns that that's a necessity and why you use it, what it shows you, and how it's improved over traditional x-rays?
Sure. So x-rays are still very, very important because as we've been talking about, there are a lot of things that happen in the mouth that you do not feel. Yeah. And when the earlier you catch something, the better off you can be. If you don't take x-rays for years and years and years, and then all of a sudden we go in and we see there's a huge cavity, we've lost so much tooth structure. So now the tooth is more compromised. So, but I think most people are going towards digital x-rays. So, they like to tell us, they train us, you get more radiation from the sunshine than you do from those radiographs. Now, somebody who's at low risk will go once every 2 years, right? Now the 3D, they do have more radiation. They definitely do. What I tell my patients is give your body a ton of antioxidants before you go to the dentist. So drink up pomegranate juice and cranberry juice, take some antioxidant supplements. We also then use a homeopathic radiation remedy. If people are worried about that, they can take that right after they have the x-ray, and that just helps the body get rid of any of those chemicals that may get in the body. But it is very nice. We can't catch these things without this kind of technology. So
it allows you to be more proactive and preventative, which we're all in that would desire, right?
Exactly. Yes.
Agreed. Okay, mercury.
Yeah, that's a big topic. But I had patients the other day. So I've become what we call SMART certified and PROTECT certification through those two, iabdm.org and IAOMT.org. Those are the two main biologic organizations out there. And so that requires, you almost look like you're in a spacesuit. You have all this extra gear. We have these special suctions that come in and out. We drape the whole head, oxygenation, the whole thing. And patients like, oh my gosh, I've had this in my head for so many years. Why is it so crazy? I'm like, well, we don't learn about this in dental school. And I was like, I've been breathing this stuff in for 20 years. I'm lucky my kids are, as healthy as they are. Yeah. But the problem is, we call them silver fillings, right? Because if we ever called them mercury fillings, nobody would ever get them. Right?
Agreed.
But they are 50% mercury. Now, what they taught us in dental school, well, once it's all amalgamated and put in the tooth, it's fine. It's locked in.
Stable is what they say. It's stable.
It can't go anywhere. However, there's a lot of research. There's a great video on YouTube called The Smoking Tooth. So look up The Smoking Tooth on YouTube. And it's a extracted tooth that has a 20-year-old amalgam in it. And they have this special photography, and they take an eraser and just erase over the top of the mercury film, and you will see the vapor rising off of the tooth. So every time you're eating something hot or you're chewing, you are releasing, it's minimal amount, but you are, so the more amalgams you have, the more mercury you're going to release. And the reason why we get so, geared up when we take them out is the two most harmful times are when you put it in and when you take it out, because we're buzzing, we're cutting open them. We try to take it out in as large chunks as possible, so we're not constantly creating the vapor. And so again, it's important that if you're going to have these mercury fillings out, that you go to somebody who is smart or Protect certified, so they do it properly, so you're not getting this huge blast of mercury vapor in your system. Mercury is insidious, and it's a real major problem. And now then you think, well, I've got 75-year-old who has a mouthful of amalgam and they're fine. They don't have any major medical issues. They're not. Well, why is that? Well, those people have an amazing detox system. Yeah. Again, speaking about individual, the other thing, I spoke to a woman yesterday, she was older and was asking these questions. And I said, the thing is, when you grew up 70 years ago, we didn't have all these chemicals. So your immune system developed on whole food, plenty of outdoor exercise, and you became robust. So you could have a few mercury fillings, even plastics weren't even invented till the 60s, right? So, so these people are more robust, in general, right? But kids today, they're already born with 200 plus toxins in their body. So they're already born with their bucket half full. Mm-hmm. And that's why we're seeing such chronic disease, because of all these other chemicals. So it's not just, I have mercury fillings, but you have mercury fillings, you're breathing in toxic air, you're having glyphosate in all your food, you're emotionally, what has happened in the last 2 years? Everybody is an emotional wreck, kids especially, right? So that bucket is so much fuller than it was a generation ago. Right. And that's why it becomes more of an issue now. And that's why we want to look on, because what we need to do, there are some toxins we can't avoid. If they're in the air, they're in the water, even in the food, we can do our best, but we can't. So what are other things that we can do proactively? And that's why going to a biologic dentist is so valuable, because you can get that mercury out, right? You can take out those root canals that may have parasites or other inflammation. You can investigate the cavitation. Mm-hmm. You can help get rid of the gum disease, change that oral bacteria. Those are things that are, and the cool thing about the mouth, it's very accessible. A lot easier to heal here than trying to heal problems in our liver, right? In our gut. Like, that's a lot more challenging. This is super accessible, and it's very easy to, and because it's a major proponent of chronic disease, it's kind of a win-win all around. And so it's exciting. I love going to Cellcore and seeing all these practitioners who are excited and who are making a point when they're doing their intake form saying, well, tell me about your mouth. Yeah. Because you are going to have more, as a practitioner, you're going to have more success when you can, again, eliminate, okay, let's eliminate that. That's kind of relatively easy, not necessarily inexpensive, but one relatively easy way to get rid of some obvious toxins and infections.
Americans spend $33 billion every single year on diets and weight loss products, and yet diets have a 95% failure rate. These statistics and my 18 plus years experience as a practicing doctor show me the real dangers of a cookie cutter approach to health, and that truthfully, diets don't work. This is why I created the 90-10 lifestyle, for the people like you and me, busy and not willing to settle for less when it comes to our health and wellness. This program isn't just about feeling fantastic and or losing weight for good. It's a roadmap to upgrading your body and mind from the inside out, while simultaneously suppressing the inflammation and suppressing the guilt that often comes with a high stress, high expectations, and high performance. The number one reason the 90-10 lifestyle is so effective and easy to maintain is that it gives you back your willpower instead of forcing it.
Agreed. I know I have a patient, he had high ferritin levels, and he's like, oh, I've had it forever. Nobody's been able to figure it out, and it's just always been there. But he, maybe every 6 months or so goes to these autoimmune crises. Like he'll lose all his hair, suddenly. And I'm like, there's something underlying that. And he's like, oh, it's just always been that way. I'm like, I know, but it doesn't make it right.
Right.
And so we referred him to thermography, looking for cavitations in the teeth. And that's going to be our next step, is to investigate infections in the mouth, because like you said, it could be completely asymptomatic and just running havoc in the background. And he's not
I always think about with those, the iron and bacteria are kind of intimately linked there, what's going on that's creating those issues. So it's so interesting. And again, it's so accessible that it's a great way to get rid of things.
Yeah. And we talked about root canals. So basically that, just leaves a little, I think it's Dr. Todd or Dr. J. Did you ever hear their analogy about it's kind of like dirty, pond water? And so if you don't ever go and clean up the dirty pond, then the bugs are you can kill the bugs repeatedly, and they're just going to come and settle back in on that. You guys know, if you have, I don't know, you even just leave something in your yard and an ability to collect water, and then bugs start growing and hatching off of it and being flocked to it. So that's kind of another area, right? The body just can go and set up infection in those dead root canals.
Absolutely. Yep. And even sometimes you may not even necessarily see it on an x-ray, but there's been so many studies that show you take every root canal tooth is infected, whether or not it is affecting you systemically. Now that's another issue, because some biologic dentists say every root canal is bad, take them all out. I don't necessarily agree with that. You have to look at the individual patient. If you have a patient who has 3 root canals, they're not on any medications, they're not complaining of any symptoms, do you need to pull those out? I don't think so. That doesn't make sense, right? Do they have infection? Maybe, but maybe their immune system is so strong that it's not affecting them negatively. Yeah. Now, if that person were to develop some chronic fatigue and something maybe we ought to look and what meridians are those teeth on, right? I have story after story of these patients with root canals, and we can talk about it at the end, but things that are related, so and the other thing I want to mention too is having dissimilar metals in the mouth, right? So if you have an amalgam next to a gold crown or next to what we call a PFM crown, so some crowns look tooth colored, but the underneath of it is actually still metal. 2 metals next to each other in saliva creates a battery. So that's a big issue too. So if you have heart issues and you have a lot of dissimilar metals, you may want to consider seeing a biologic dentist and making sure that you do not have, so you could have a silver filling up here or gold one down there, but anywhere, kind of near each other can be problematic, causes a galvanic effect.
I didn't know that. I had to mute the microphone. My dog is out here. He's our office dog, and he's on every podcast, whether you guys know it or not. There was just noise and he was barking. I'm like, no, I didn't know that. That's so interesting. Mm-hmm. Okay, so we talked about fluoride and antibiotics. We talked a little bit about mouthwash. People think they're doing the best thing on the planet, right? But they're ruining the pH. And what else does mouthwash do? A lot of them are alcohol-based, right?
Oh, yeah. Think about how most of them are fluorescent blue. Is that natural occurring? No, it's not. And the problem, again, is not about killing, right? It's about how do we create a healthy environment so the good ones will grow. So when you have something that's alcohol-based and you're just killing stuff, you're, again, not really fixing the problem. The other problem is if you kill too many good bacteria, then you are losing the ability to create nitric oxide. Nitric oxide is made, after 40 or so, we don't make as much peripherally. And so one really major source of it is breathing through your nose. And at the back of your nose is where there's this bacteria that helps convert into the nitric oxide, which is what helps dilate our blood vessels so that our blood can release more oxygen into the cells. So one of the major impacts of, and a lot of people will have gum surgery and they'll be given something called chlorhexidine. And that's another one of those blue, terrible mouthwash. And yes, it prevents infection, but you're also killing, it's just like taking an antibiotic, right? You're killing the good stuff, which is so important for your immune system. So you're actually not doing yourself a service. If you want to use any kind of mouth rinse, try oil pulling, try plain old hydrogen peroxide in a brown bottle, few cents, right?
Yeah,
it does
so
not
cheap.
cost anything.
Yeah.
Swishing that 50-50 with water. It's not good to do that long term, because again, that does kill some things too. But acutely, if you have some weird something going on, when I do a crown, I make my patients swish like that for 2 weeks because I don't want the gum to get inflamed before I have to seat the crown. But for maintenance, 2 to 3 times a week is a great way to make sure you're oxygenating the environment. And bad bugs cannot survive in an oxygenated environment. So that's why ozone is so effective. Breathing through our nose, the more oxygen we get is just absolutely vital for health.
So is mouth taping a good thing?
It's a great thing. Patients always look at us really funny, but if people are snoring or having issues, we say, try, 3M makes a little micropore tape. You can buy it right on Amazon. You can still breathe through it. Now, when I first started doing it, it did take me a few days to get used to because I was more of a mouth breather. So I'd rip it off in the middle of the night. But, after a few days, I started getting used to it and you'll sleep so much better. And again, when we sleep, it's so important. That's when we're supposed to be restoring. We're supposed to be cleaning out the junk, restoring our body. And if you are mouth breathing, then you're in that sympathetic state all the time. And when we are in sympathetic nervous system, we can't repair. That's when we get chronic inflammation. Also, if you have sleep apnea, snoring, you're not getting that deep, profound, restorative sleep. So mouth taping is really, really great to train yourself to breathe through the nose.
I'm like taking notes like a schoolgirl over here. I'm learning so much. I think I actually do the podcast for myself. And then if other people get awesome info and it helps them too, I'm excited and happy. Okay, so we talked about oil pulling, mouth taping. This was one on your website. I don't even know if I'm going to pronounce it correctly. Biomimetic dentistry.
So biomimetic dentistry is the idea of trying to maintain as much natural tooth structure as possible. So that's what we talked about with x-rays. The smaller we can get something, the more tooth structure we can preserve. So when we do a crown, we're cutting away a lot of tooth structure. And sometimes, that's the only thing we can do. But also with biomimetic dentistry, say you have a very large filling. Well, we don't want to use amalgam. We want to try to avoid a crown. So we use these techniques with materials that are more like natural tooth structure. So in a tooth, we have the outer enamel, the whiter part. Inside that is the dentin, which is a little more yellow. And some you may notice like at the gum line, if you have a little recession, like the root surface looks a little more yellow, that's dentin. And that's why it's more sensitive right there, because we don't have the enamel covering it. So you're a little closer to the nerve by the dentin. And so dentin and enamel, they react, they will expand and contract differently, right? Just like, and this is the problem with amalgam or silver fillings, they always crack the teeth. They do last a long time, but they crack the teeth because in hot and cold, they're going to expand and contract and they cause cracking. So in biomimetic dentistry, we use things, I use 2 different kinds of white, filling material, one that's more like the dentin and then one more like enamel. And underneath, if you have a large one or if you have cracks, that's the one thing in dentistry. Oh, I have a crack. Do I take the crack out? Well, if you take a crack out and you lose that wall, you're losing structure and strength. So there's this fiber that we use. It's called, one of the most common ones called Ribond. It kind of acts like rebar in cement. You put this little fiber within that tooth colored filling material and it causes more strength and support in that tooth. So you can build up these very large fillings with just the bonding material. So again, we're mimicking nature. And those teeth, they may never need a crown because again, we were thinking about nature, we're thinking about how the tooth was made. So if you can find a dentist who understands it and uses biomimetic dentistry, you're going to have more preservation of your tooth structure.
Yeah, that's just goes
cheaper.
Completely in alignment. It's cheaper too. Good.
Yeah.
It's just hey, something healthy for you is actually less expensive.
Yes, I know, it's amazing.
When does that ever happen, right? But it's being more proactive and preventative and restoring structure and function. Like that makes just complete sense. I love it. Can enamel repair? Because isn't it when it's yellow, you're seeing more of the dentin, like your body loses the enamel? What is that from?
So, it's really interesting. I looked back years and I was fitting myself for a special mouth guard. I was like, boy, my teeth are looking so, yellow right at the gum line. And that was when I was going through a lot of stress with eczema. So I was leaching a lot of minerals to try to neutralize that, inflammation in my body. And so again, think of a tooth as a living, breathing organ. And with that, think about the nerve supply, the blood supply, the lymph in a tooth. So normally, when everything's good and healthy, fluid from the blood will flush up into the tooth, deliver the calcium, the phosphate, all those minerals that make enamel hard. And it'll pull out the bad stuff, right? That's what lymph does. It delivers stuff, it collects the junk and takes it out. Now, if you're very acidic, if you have a lot of free radicals going on, there is a hormone called your parotid hormone. Parotid glands are the salivary glands here. The parotid hormone is responsible for the proper fluid flow. So when we have a lot of inflammation, a lot of free radicals, reactive oxygen species, that production of that hormone stops. And then the fluid reverses direction in the tooth. So now instead of depositing the calcium and the phosphate into the enamel, now it's being pulled out. So now your teeth are less white. It's thinner. The enamel is actually thinner. Sometimes we think of the tooth when it comes out of the mouth, the enamel, it's static, but that's not true. We're constant, like everything in our body, right? We make a whole new body every 7 years. Entirely new body. So the teeth are part of that. They're an organ. So we're constantly regenerating. So can you regenerate? I think you can. There's so many factors though. It's like my daughter, she had one little cavity that I noticed on an x-ray. Couldn't see it in her mouth on an x-ray. And I said, okay, I was like, you're going to be my test subject. Yes. Can we reverse this? Because I have never seen it reverse. I've seen a lot of times it stop, right? But can you actually put back, and again, there's no studies that ever prove that you can 100% cure. Again, you can you can arrest the decay, but can you cure it? So I've been using a ton of ozone on her. I've been making sure she's getting lots of her fat soluble vitamins. We're using a homeopathic remedy for cavities too. So I'm like just trying all these things, but she's also a teenager and she eats junk.
Yeah, so in that population.
So it's challenging, but I just took another x-ray. Doesn't look better, but it doesn't look worse. So, so I'm just going to keep doing what I'm doing. So, but in theory, it would, yes, you can reverse it. But again, we live in such a toxic world. It's very challenging. Right. So, I'm hopeful that yes, we're going to make the breakthrough, but not until we can really get our nutrition stuff, under control.
Absolutely.
So
what
it's not about fluoride.
Go ahead. I didn't mean to interrupt.
So that's the thing about fluoride we didn't really mention. So topically, fluoride works by killing bacteria. Okay, so that's why, you're not going to get cavity if you take fluoride. However, there are over 66 studies proving that fluoride has a major effect on IQ, right? Fluoride is a toxin because most of the fluoride in toothpaste and in mouth rinses, this is again, a synthetic industrial byproduct. It is not naturally occurring fluorine that we see. It's not naturally occurring, right? But also fluoride is not a natural component of tooth structure. It's not, it's not. So we don't need to be putting fluoride in the problem in trying to fix something. So I'm not a proponent of that.
I don't know if you want to go way back, but wasn't fluoride used in concentration camps to kind of like dumb everybody down so that they would just follow the leader and be easily manageable? People don't realize that. No,
it's a neurotoxin and it majorly impacts your thyroid. How many people are walking around with thyroid issues? Well, the fluoride competes with iodine, right, to make proper thyroid hormone. And not to mention like bromide that we have all in fluoride, all these things are competing to have an effect, but fluoride's a big one. It will compete with iodine.
And your two areas that need fluoride are your teeth, your thyroid, not your teeth, your thyroid and your breast, and they compete with
iodine.
Yeah, with iodine. Yes. Yeah, but fluoride competes with iodine. And so again, we're talking about the connection between teeth and breast health, because I don't know if this episode will air in October, probably. It's Breast Cancer Awareness Month. So there's another issue right there. Fluoride competing with iodine. And if your thyroid's deficient, then you know your breast tissue is deficient as well.
Yes.
What is your school of thought on teeth whiteners? Is there a natural way to do that? Because that's a big thing.
So again, the more minerals that you have, the whiter your teeth are going to be, right?
Mhm.
So naturally white, it really comes from that mineral content. And I noticed, like, little kids, like their baby teeth, are super, super white. And then they get their other teeth and they're always a little bit darker, a little more yellow, because when they're developing in utero, they're stealing all of mom's minerals, but then as a child, and then they become in this toxic world, there are fewer and fewer minerals. So that's a good natural way. Hydrogen peroxide is another way. Again, the whitening effect of the oxygen is really helpful. I don't think there's any problem with the tooth whiteners that you can go and have the dentist, they say, oh, it's going to permanently damage. I don't think that's true. It's minimal. They're all peroxides. Which is pretty normal. So I don't have any issue with that at all.
What about the lights? You see the blue and red light thing?
Yes. And I was like, well, what's this all about? And then I bought it. And it used to be, they just had like a blue light and it did nothing. It never, but now the one with the red light. So red light is good for circulation, right? So thinking about how do we get more minerals into the teeth if we have more circulation coming through the teeth. So, and I love red light for a lot of reasons. But is that what's making the teeth whiter, or is it just, again, the increased circulation? And red light, it stimulates your mitochondria, which are responsible for keeping everything healthy. So is it directly influencing the whitening of the teeth? I'm not sure about that.
Yeah, but it's improving like that lymphatic flow for sure to the teeth, which I don't think anybody really thinks about supporting. So that's really good. And how about the charcoal? These are common, like the charcoal mouth powders or charcoal toothpastes. Are you a proponent of those?
So, charcoal is supposed to bind up, the toxins and take it away. And maybe, it is effective. I use a lot of the Cellcore products because they're way better than charcoal. And I have people open them up. They don't taste great, but they work really well. With all my gum disease patients, they use the biotoxin binder. They swish and swallow that. So, I'm not, as long as you're not using a fluoride toothpaste, and I like kind of like my probiotics, I like to switch them around. So there's a couple brands. I like a lot of the powder-based toothpaste, honestly, that have the natural minerals in them. Because again, that's what we need. We need minerals. We want to have healthy teeth. We need minerals. So we need lots of leafy greens. We need the minerals. So, and even with the oil pulling, people swear by it. Should you do it every day? It's kind of like everything in moderation, right? So that, maybe maintaining a couple times a week if you like it, if it makes your mouth feel better, but it's kind of what is going to get you to brush and floss your teeth.
Yeah, if you're paying attention and you have some consistency and you've got a oral hygiene habit, I think that's probably what you're going for most of the time with people, right?
Yes, exactly.
Consistency is key. So let's share what's one of your favorite success stories or something that kind of like paints the picture of how like your teeth, dentistry isn't just for the health of your teeth.
So I have a couple interesting stories. One younger guy who's maybe in his early 30s, and I was looking at his x-rays and he had a root canal in a lower left molar, and it looked a little funny on the x-ray. And so I asked him, I said, do you have any aches and pains anywhere? And he said, and I didn't say anything about the x-rays. So I just looked at him and then I asked him this question. And he said, my left shoulder, I can never get it to heal. No matter what I do, I'm an athlete, I did X, Y, Z, and it just never gets better. And I said, well, interesting, you have a root canal on that same meridian. I was like, it's possible, that if we take that tooth out, we can kind of restore good energy flow. Maybe it'll get better. So he believed me and he went ahead, got the tooth out, and his shoulder got better within a month.
That's so
You
cool,
know,
because I'm a
super cool.
chiropractor and we do see people that like no matter all the great positive things they're doing won't get better, and that's when we know to look elsewhere.
Yeah,
Awesome, really
yeah.
incredible.
So that was cool. I have so many interesting stories of patients getting a hip replacement or a knee replacement, and then all of a sudden the tooth hurts on that same meridian. I had another woman the other day. She has a root canal and an upper first molar, and she just had her hip replaced. And so, and then I was showing her my tooth meridian chart. I said, this is also on the breast meridian. And her jaw dropped and said, oh my goodness, I just got diagnosed with a lump in my left breast. Right. So that connection, I was like, well, maybe want to think about what we want, maybe taking that root canal tooth out,
Yeah.
And she was an athlete too, it's not like she's young, and having a hip replacement at 40,
Wow.
yikes.
Yeah.
So, just, I see those connections all the time. I had, my mother's cousin actually had, I was trying to help her before I really understood a lot of this with her SIBO, and nobody could really help her. And her doctor kept referring her back to me because I was telling her stuff that was making her get better.
Yeah.
And then she was seeing another dentist. She came to me and she had a huge abscess on upper first molar and ended up with breast cancer. So, we cleared all of that out. She's doing great now. But it's amazing. Once I learned that, I just see the connection day in and day out. My best story is when I, did at Cellcore with my hygienist who cleared all the parasites out of her body. She's 62 years old and she had constipation her entire life. We got her just taken, actually it was high dose vitamin C. That's what got her bowels going. And then we got all her parasites. She had all autoimmune markers everywhere. And in, a matter of few months, all autoimmune markers completely gone. And she feels like a new person. And she's like, I can't believe I had to go to my dentist to get well.
I'm sure people get kind of frustrated that they, I'm sure coming to you, same as me, I wish that everybody came here as their first stop, but a lot of times you're their last resort, or they just kind of you ask it, you pull it out of them, but they just didn't probably think that you were going to help them with all that stuff.
Right.
Yeah.
Right. Yeah. It's amazing. It doesn't really matter what type of practitioner you are, right? If you understand the whole body connection, you can help people so much because you know where to direct them to really get at the root of the problem.
Agreed. And the more of us that there are that are teaching patients to think differently, change the paradigm in their own mind about their body and the potential for healing. When you walk in our office, it says, there is hope your body heals. Let's just start with that conversation, regardless of all the doom and gloom and names and things that have been cast on you and people declared over you. I just refute it,
Yes. Right.
Yeah.
Yeah. I don't want to hear your diagnosis,
Yeah.
We can get at the issue.
Agreed. Well, tell us a little bit more if people want to get in touch with you or even search, is there ways that you can help people remotely? And then of course,
absolutely. I do a lot. I do a lot of health coaching stuff by Zoom. So we do a lot of that. Patients are traveling to see me, but I'll do a lot of Zoom consultation patients who are far away to help them. Okay, well, why don't you see so-and-so in this area, have some connections through the different organizations. And can give a lot of recommendations, and we use how do I use, Cellcore for dentistry? How do I use other different kind of supplementation? So yeah, great way to get is just going to my website, carverfamilydentistry.com. It's again, a work in progress, but you can get some information there. There's an Ask the Doctor that goes directly to my email or giving a call, and usually my front office can set up the Zoom conversations.
Awesome. And then I will put the links, I know it's IAAOM, whatever.
Yes, IAOMT. Yeah.
Okay, I was almost there. We'll put the links to the organization because I know you can find a biologic dentist in your area. Anything else you want to mention as far as training certifications to look for to vet, if you're looking for a biologic dentist?
So I would definitely want somebody who uses ozone. I mean, that's just, an easy, crucial thing. And the more training they have, looking for a patient who understands about airway, that's kind of become a little bit bigger in dentistry too. But sometimes a lot of our issue as a chiropractor, if the bite is off, then everything is off, right? The neck, all the way to, your tongue is connected to your little toe by fascia. So if you have a tongue tie, or you have some people have like an open by a space between their top and bottom teeth because of a tongue thrust, well, that's going to cause all sorts of issues for your neck and shoulders. So certain of us biologic dentists also have some training in airway and need to understand the way that the teeth come together matters, right? So if you're snoring or have sleep apnea or something like that, that's going to affect your whole structure. Like we have a laser now, it's amazing non-invasive therapy to stimulate the collagen to shrink back up and open the airway. And that's, again, a root cause way instead of a CPAP machine that's just artificially forcing air, or a mandibular device that's pulling your jaw forward artificially, which can affect the joint. The laser is able to actually fix the tissue. So it's awesome, totally non-invasive. It works really great just using light. So, just hopefully, looking at there's a lot of dentists, they have good websites. Mine isn't good compared to some other biologists have a lot of great stuff. It's on the to-do list here, but but also if you're working with the right person, most of them will say, let's do an email or have a Zoom conversation. You kind of, before you go, you can interview them. And if somebody is willing to help you, they're going to be more than willing to have that conversation with you.
Yeah, I know a lot of places will at least offer an initial consultation, whether it's in person or, Zoom remotely, to kind of talk about your goals and why you're going. Usually when people are looking, it might just be preventative, when they just don't want to get involved and go down the road with all the traditional, root canals and fillings, etc. But a lot of times people do have chronic issues and they're looking for somebody to look at it from a different perspective and holistically as well. But yeah, I'll put all of those links that you mentioned and some that I know about in the show notes for people's easy access. And then on your website, I'll mention too, something I thought was great. She's got a great resource of reading materials, like books that she recommends. And I know one that you were just kind of talking about was that Tongue Tied. I actually wrote a little note. I think it would be cool to have an expert who corrects tongue ties and understands that in a future episode. So that'll be our above the collar next episode.
Yes, and that's a good one. And with the laser, it takes about 30 seconds to do that kind of treatment,
That's so cool. That's
Yep.
awesome. Well, you've been a wealth of knowledge. I know I enjoyed it and learned a ton. I think we talked about a lot. So this is probably going to be an episode that you might want to listen to on repeat. And if you were listening to it in your car or somewhere where you couldn't take notes, you might want to even listen to it when you get in a quiet place and kind of write some of these things down. Well, thank you so, so much.
My pleasure.
I appreciate it, and I hope to see you in person at a future ECO conference.
Absolutely.
All right, everybody, that was another episode of the Weird Works podcast. Until next time, we are encouraging you to live a health in life naturally. Your health and how you feel on a daily basis directly impact your mental, emotional, and spiritual health. We will help you reprogram your way of thinking and be on a plan that works for your body instead of against it. It is time to rewrite the false belief that health abnormalities are normal and that it just is what it is. You do not have to live with feeling less than 100%.
We invite you to take a serious look at how you feel on a day-to-day basis. Is what you're doing working? Do you want to learn how to live a more holistic life that's still enjoyable and fun? The 90-10 lifestyle can be the bridge from subpar results to the vibrant and abundant lifestyle that you've been looking for. So click the link by this video so you can get started today. We truly, truly know that this program can change your life. We'll see you on the inside.